Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What does low hemoglobin mean? Low hemoglobin means you don't have enough of the red blood cells that carry oxygen throughout your body. When you have low hemoglobin, your cells and tissues don't receive as much oxygen as they need, which can make you feel weak and tired. /r/n/r/n Low hemoglobin levels can be caused by a diet low in iron, gastrointestinal, GI, bleeding, GI surgery, and heavy menstrual bleeding, among other things. Some of the symptoms related to low hemoglobin include body aches, chest pain, weakness, fast heartbeat, and shortness of breath. /r/n/r/nVioletaStoimenova. Getty Imagesrnrn Hemoglobin is a protein in your red blood cells. It transports oxygen from your lungs to the rest of your body and removes carbon dioxide from your lungs. When your hemoglobin levels are too low, it means your blood can't complete these tasks as efficiently. /r/n/r/n Hemoglobin is measured in grams per deciliter, g/dl. Normal hemoglobin levels vary depending on age and sex. Generally speaking, hemoglobin levels are considered normal when they fall into the following ranges: :r/n/r/n. Your hemoglobin is considered moderately low if it is between 8 and 10 grams/dl. Hemoglobin levels of 6.5 to 7.9 grams/dl are considered concerning, and anything less than 6.5 grams/dl may be life-threatening. /r/n/r/n When your hemoglobin is too low, you may experience a range of symptoms related to the lower levels of oxygen in your body. Low hemoglobin symptoms may include /r/n/r/n Some people are at greater risk for low hemoglobin. They include :/r/n/r/n There are a few possible causes of low hemoglobin. /r/n/r/n Some examples of bleeding problems that can lead to low hemoglobin include /r/n/r/n Your body produces red and white blood cells in your bone marrow. But your body may not make enough red blood cells if you have conditions that affect your bone marrow's ability to produce or support enough red blood cells. Examples include /r/n/r/n Cancers that can cause low hemoglobin production include /r/n/r/n Sometimes your body produces enough red blood cells, but the cells are dying faster than your body can replace them. Conditions where this happens include /r/n/r/n You may have low hemoglobin if /r/n/r/n Other reasons you might have low hemoglobin levels include /r/n/r/n Newborns can have temporary anemia at 6 to 9 weeks if they haven't made enough new red blood cells and have used up the ones they were born with. This anemia usually resolves on its own. /r/n/r/n Babies can also have anemia from breaking down red blood cells too quickly if the mother and baby have different blood types. /r/n/r/n However, most newborns have sufficient iron stored in their bodies for about the first 6 months of life. After 6 months they need an additional source because breast milk doesn't contain enough iron. Iron-rich foods, iron-fortified cereals, iron-fortified formula, or iron supplement drops can be added to the baby's diet to help prevent low hemoglobin levels in infants. /r/n/r/n Iron deficiency anemia is just one type of anemia. Pernicious anemia, aplastic anemia, and hemolytic anemia are some of the other types. /r/n/r/n The symptoms of low hemoglobin are similar to the symptoms caused by many other medical problems. That's why it is important to see your healthcare provider if you have these symptoms so they can determine the true cause. /r/n/r/n To help diagnose and then treat low hemoglobin, your healthcare provider will order a blood test called a complete blood count, CBC. This test will measure your hemoglobin level and red blood cells. Your provider will likely also perform a physical exam and other diagnostic tests. /r/n/r/n Treatment of low hemoglobin will depend on your age, the severity of your low hemoglobin, and the cause. In particular, treatment for iron deficiency anemia may include /r/n/r/n. You may be able to help fix low hemoglobin levels by adding more iron-rich foods to your diet. These include /r/n/r/n consuming more foods that are rich in vitamin C, such as citrus fruits, can improve your iron absorption. /r/n/r/n Slightly low hemoglobin levels aren't necessarily a cause for concern. Some people have naturally lower hemoglobin than others. /r/n/r/n If your hemoglobin levels are very low or you have symptoms such as fatigue, shortness of breath, unusually pale skin, or dizziness and lightheadedness, talk to your healthcare provider. /r/n/r/n It isn't always possible to prevent low hemoglobin. When you have preventable iron deficiency anemia, the most effective strategies include /r/n/r/n There are several causes of low hemoglobin related to problems with bleeding, red blood cell production, nutrient intake and absorption, and others. Symptoms of low hemoglobin include headaches, fatigue, fast heartbeat, and pale skin. /r/n/r/n Treatments for low hemoglobin include iron supplements, iron therapy, blood transfusion, surgery, and treating the underlying condition causing low hemoglobin levels. Adding more iron-rich foods to your diet is also important if you have iron deficiency anemia. /r/n/r/n If you have low hemoglobin, work with your healthcare provider to determine what is causing it and find a treatment plan to help you manage it. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.